Hi, my name is Andrea Lacoste. I'm a third-year naturopathic medical student at the Southwest College of Naturopathic Medicine. The purpose of this presentation today is to discuss naturopathic medicine. So I'm going to start with a basic overview of what naturopathic medicine is. I'm going to talk about the principles of naturopathic medicine, the therapies that we commonly use, what you would expect out of an office visit, the education that goes into naturopathic medicine, the states that license naturopathic medicine, and how naturopathic medicine and conventional medicine fit together. Naturopathic medicine is a form of medicine that focuses on finding the root cause of the disease versus just treating the symptoms. We also like to treat the entire person. So instead of just treating the physical aspect of you, we will look at your emotional and your spiritual aspect as well and take everything into account. We typically try to use natural modalities, and these may include botanical medicine, oriental medicine, nutrition, homeopathy, etc. There are situations, however, where pharmaceutical medication is warranted, and in those situations, we will prescribe the pharmaceutical medication. This, of course, is going to depend on the state that we are practicing in and whether or not we are licensed and what our prescription rates are. An example of such a situation would be if we have a patient that comes in who, upon lab testing, shows that they have little to no cortisol. Well, we're going to prescribe them cortisol. But at the same time, we're going to prescribe them adaptogenic herbs and supplements and things like that that are going to help restore their adrenal function. Therefore, the goal of that is that they won't have to be on the cortisol forever, that we can restore their function, and eventually they can come off of the drug. There are 6 principles that naturopathic medicine is based upon. The first principle is to do no harm. I think that's pretty self-explanatory. The second principle is the healing power of nature, and that refers to the body's innate ability to heal itself. The third principle is to identify and treat the cause, and this is what I spoke about before. But if you only treat the symptoms of a disease, then you'll never get rid of the disease. If you actually go to the root cause of the disease, then you have a chance at eliminating the disease. So we try to go at it from the root cause. The fourth principle is to heal the whole person, and I spoke about this earlier about taking into account the emotional and the spiritual and the physical and the person's life in general when creating a treatment plan for that person, because everybody is unique. The fifth principle is physician as teacher, and this is based on the idea that it is a doctor's responsibility to be educating his patient or her patient about their health and their well-being and the treatment plan and why we're giving the treatment plan, so they understand what the treatment really is and where they're going in their health. And finally, the last principle is that prevention is the best cure. And I have to put cure in quotation marks, but we all know that if you prevent the disease from ever happening, then you never have to treat it, and therefore it's much easier to treat. There are many modalities that naturopathic doctors may use, and I will only talk about a few of them. The first one I'd like to talk about is oriental medicine and acupuncture. It's kind of hard to explain what exactly oriental medicine is unless you get kind of into the depths of it. But in a basic sense, it's using oriental medicine principles to diagnose an imbalance within the system, and then using things like acupuncture and cupping and Chinese herbs and lifestyle changes to restore that imbalance and bring you back into your center, essentially. Another modality is nutrition. And that's looking at your diet and your nutritional need and your food allergies and your gastrointestinal health and all of this in order to help heal the whole person. And this may include supplementation, it may include lifestyle changes, it may include diet changes and going on a special diet and things like that. Another one is botanical medicine. It's fairly self-explanatory. It's using plants as medicine. We try to use it as a restorative sort of medicine instead of just a replacement for pharmaceuticals. The nice thing about plants is that, typically speaking, there's low side effects, but that is not always the case. There are some fairly toxic plants out there. They can be used in medicine, but generally only under the supervision of a licensed healthcare practitioner. Then one is homeopathy. Homeopathy is generally a big one at our school. It's based on the principle of like cures like. And what this means is if you take a substance that at its normal regular concentration will produce what we call characteristic symptoms, but then at its very, very diluted concentration, it will actually eliminate these characteristic symptoms. So it sounds a little bit strange, and it's very, very specific to each person, but it's also very effective if you get the right remedy. Another one is physical medicine, and that includes but is not limited to physical manipulation, which is just your basic adjustments. You can also do things like trigger point release. There's also hydrotherapy, which is a favorite of mine. Most people think that hydrotherapy is just putting a hot pack on a sore muscle, but really what it is manipulating the body's circulation to enhance the immune system, to decrease pain and inflammation, and things like that. Typically, it's going to be like an alternating hot and cold, but not always. Sometimes there's, you put like a cold wrap on and you allow your body to heat it up. That would also be an example of hydrotherapy. We can also do minor surgery, and that would involve cyst removal and putting sutures into small wounds, things like that. We don't do anything major, just the little, in-office type of things that require local anesthesia, essentially. Your first visit with a naturopath may last anywhere from 1 to 2 hours. Typically in that visit, they're going to gather information about what brings you in that day and your current illness. They're also going to look at you as a whole person. So they're going to talk about your diet and your lifestyle and your career and your hobbies and your social outlets and your marital status, how much water you drink and how much soda you drink and how much coffee you drink, and really get a good picture about who you are. At that point, then they will also perform any necessary physical exams. That could include just a basic HENT. Could also be a lung exam, a cardiovascular exam, maybe a male genital exam or a female pelvic exam. It'll really vary depending on the situation. They will also order any necessary lab tests that need to be run. At that point, they're going to develop a treatment plan for you based on all the information that they have gathered and go over it with you and talk with you about it. Your future visits then will last maybe 15 to 45 minutes depending on why you're in. If it's just a basic follow-up to get lab results or check in with the doctor to see how you're doing, it may last 15 minutes. If you have a new symptom and complaints going on, it may last 45 minutes. So that kind of gives you an idea of what you're going to actually experience in an office visit with a naturopathic doctor.